From Dr. Daniel Laroche, a physician at Mount Sinai in New York and the president of Advanced Eyecare of New York. Doctor, you're so convinced of the importance of the vaccine, you say it's unfair for unvaccinated patients to even go to the hospital for treatment. We've been talking about messaging here. Is that your message?
Well, the thing is, first, we have to do a better job at educating the community about the vaccine and how safe it is and how it can prevent the COVID virus deaths and pathology that occurs that can lead to serious illness. That's first and foremost. We still have a lot of room to do with educating patients, educating underserved communities, educating the Latino population, educating the poor community. That's one. Then we can create incentives, whether it's with gift cards to get vaccination and the private sector creating incentives to get people vaccinated.
Right. Well, nothing's really worked up to this point. Yeah.
Well,
but I mean, I guess to your point.
And then penalties. But there are some people who, for whatever reason, refuse to get vaccinated. For whatever reason, whatever the incentive, whatever the penalty is. Now, those people, if they refuse to get vaccinated, that is your right. But if that's going to be your right, when you get infected with the COVID virus, then stay home. Don't infect my colleagues. Don't take up the space of a bed from another patient of mine that needs resources for their asthma, for their heart disease, for their GI. You know, if you want to really, you feel that strong about your right and you don't trust medicine, you don't trust the science, you don't trust doctors, you don't trust the vaccine, well then why do you trust doctors when you get vaccinated and you're short of breath?
Right. I'm sure people watching will ask, doctor, can you do that ethically? I mean, I know you're not saying you won't treat them, but there are some who are saying that. In Florida, I know we heard of today, doctors who say they won't.
Well, I'm in New York, and we're doing better with the vaccination rate. We're like over 60%. But I can see at a certain point if this continues to go on, because we take care of sick patients in our office.
Right.
If someone comes in unvaccinated, they can transmit their virus. If they're infected, they could be a sliding transmitter to other patients in our office or in my office and make them sick, where they could bring it home to their family members. So I think there's a window of opportunity for people to get vaccinated to help prevent deaths from COVID. Look at Iceland, for example. Iceland is 80% vaccinated. They've had 0 deaths since May. And when you ask someone from Iceland why they got vaccinated, they say it's their civic duty. And so we need to step in that direction, because vaccination works very well. And so providing incentives, providing better education, putting resources in underserved communities where we know, for example, in Mississippi, Alabama, West Virginia, they're under the 40% range, okay? They're lagging. So we need to put more resources in those areas to educate people, provide incentives, and eventually down the line provide penalties and to help increase and get rid of this pandemic.
I realize it may not be apples to apples, doctor, but isn't this a bit like a cancer doctor saying smokers shouldn't come for treatment? I mean, that's who gets lung cancer, isn't it?
Yes, to some extent, but smoking's been around for decades. Public information and education have been around for decades. This is a relatively new thing with a pandemic. There are seeds of mistrust within the community, particularly the African-American community, because of history of experimentation and things of this nature. There's also a lack of understanding of how safe the mRNA vaccine is. I know some of my patients, for example, say, well, if I take this vaccine, I'll become infertile, or this can kill me. And so we need to do a better amount of education. For example, in the African-American community, there's a shortage of physicians and healthcare providers within the African-American community. So that's why they're lagging with the vaccination, because the message is not getting 100% there because of that. So we need to put more resources in the African-American community, Afro-Latino community, and poor communities to really educate, provide incentives, and then penalties.
Yeah, we saw the stat there, 28% of black young African-Americans in New York have only been vaccinated. Dr. Daniel Laroche, thanks for your perspective tonight. We appreciate your time.
Thank you very much.